feel like we're fighting for our lives in a system built to wear us down. And here's the twist. Your doctors, your clinicians feel a lot of that same weight as they fight to take care of you. My name is Scott Johnson, and I've lived with type 1 diabetes for 45 years. And today on Around the Circle, we're looking at why the system struggles to get people with T1D what they need. All right, I'm excited to talk with Natalie Bellini and Quiana Howard. Natalie is an endocrine nurse practitioner and the program director for diabetes technology at University Hospitals in Cleveland. And Quiana is a PhD candidate and clinical nurse research specialist at University Hospitals. Natalie, Quiana, welcome. Thanks for sharing some time with me today.
Thanks for having us. Yeah, we're excited.
Well, Natalie, you've lived with type 1 for a long time. Tell us a little bit more about how and when you got involved in diabetes professionally, and has that always been in a clinical care role?
So after graduating nursing school, I actually did a little bit of work in a cardiovascular recovery unit, and then very quickly realized that people with diabetes ended up with heart disease, heart attacks, strokes, post those kinds of things. And I thought, we have to fix this before now. I can't live watching these people die from diabetes ultimately or suffer from cardiovascular events. So I met one of our endos, and one of the endos said, well, you could come and work in diabetes. And I never even knew a diabetes educator role existed before then, because I had never seen a diabetes educator. There were years when we didn't have those kinds of roles, right? So it's been years now that I've been in the role of diabetes. So first I was a nurse, then I went back to nurse practitioner school. So that's kind of how my role has evolved.
My mom was a career nurse pretty much her whole life. And so I've got a lot of love for nurses and everything that you and other nurses do to take care of us. Quiana, how about you? How did you get interested in and involved in diabetes care?
So it's a pretty cool story. I actually started in cardiovascular. I was a cardiovascular nurse, and then I went to the ER. And our COO happened to have a stroke. And so I was his nurse. So nervous to be his nurse, but I was his nurse. And I have a passion for health disparities. And I was in my master's program at the time. He ended up going back to work, recovering, and he reached out to me about a job to work with a program called Achieve Greater, which deals with going into Cuyahoga Metropolitan Housing Authority and, educating people about cardiovascular health. And that's how I got involved with diabetes, because I kind of straddled between both programs and took care of patients that way with our chief cardiologist.
Tell us a little bit more about your current research. What are you working on there?
So I kind of look at social vulnerability, right? So where people live. Oftentimes we'll prescribe medications or we'll tell people things to do, and then we send them right back in the communities that might not have the resources for them to do that successfully. So I look at social vulnerability, I look at perceived discrimination and how those experiences can shape cardiovascular health outcomes.
I can only imagine how underexplored that space is. So thank you for devoting your time and energy there. Natalie, listen, you have what seems like boundless energy. You're a highly skilled and credentialed healthcare professional who also lives with type 1 diabetes. Can you talk to me a little bit about what people really need when they're diagnosed with T1D and what they typically get from the healthcare system today?
Wow, what a loaded question, right? So what do we need? We need, people that get diagnosed with type 1 need insulin, right? That's the easiest part in my world. It's the other stuff. It's how does insulin really work in the body? Where do you give it? What do you need? What about psychosocial support? What about the psychological stresses of it all? What about access to the medications? I give you, let's say, one ultra long acting basal insulin. Well, your insurance doesn't cover it. It kicks it back again. Then I get this, then I get that. They need to understand insurance coverage. So I want them to have this, this, and this. These are the best. This is the best basal. This is the best CGM. This is the best insulin pump. And then I get kickback after kickback because their insurance either doesn't provide it, or they've got these high deductible plans, or they've got, so we look at this as you need medication, but you need support to get that medication, understanding why that medication needs to be there. You need an ability to pay for the medication, right? A lot of people that get diagnosed with type 1 diabetes, especially when 60% are above the age of 19, are adults that might be very healthy otherwise. So now all of a sudden they have not the greatest insurance because they've never had to buy great insurance because they've been healthy. You know, my youngest brother has a $10,000 deductible and he goes to the doctor twice a year. He's completely healthy. What if he ended up with type 1, right? In one hospitalization, that whole bill would be covered, right? So it's about insurance. It's about the psychological of what did I do to deserve this? By the way, it never goes away, right? That whole idea that like on my birthday, I still have to look and say, oh, what's my glucose today? On my birthday, I want a piece of cake. I have to count the carbs. I have to make a guess. I have to decide, am I right? All of that goes with it, right? As you know, Scott, it's like it never goes away. And so you have to learn how to count carbs and what fat does and what protein does and what exercise does. And I mean, there are so many things that, especially as an adult, when you typically don't get admitted at diagnosis, these people are given like a little bit of information and say, go home, here's some website, right? But it's really hard to get the education that is needed to understand the intricacies of managing type 1 specifically.
You also, as clinicians, have things that you need to accomplish and get done during these appointments. And it's not like you can follow me around after we've had a chat to see how things are going. Tell me a little bit about what it's like from that clinician standpoint, trying to accomplish all the goals you have and things you need to do in those appointments.
So, Quiana, do you want to take this one? Because sometimes when we have very high need patients, right, our educator team sometimes can take over some.
I was going to say, we function as a team. We can't do anything in life alone. So wherever I can help, as I'm preparing to be a diabetes educator, I help Dr. Bellini and all the clinicians here if I need to go in and see the patient, spend more time with the patient, call the patient, and just in an effort to be transparent, I might even show up at a library to meet the patient. So I think it's also important to meet people where they are. They can't always come to you. So sometimes I make sure that I can go and meet them where they are and help them as much as I can.
Yeah, that's really amazing. And thank you for doing all that. I would imagine that some of those actions also really help break down some of the cultural barriers, such as like there's a general mistrust in healthcare providers and healthcare professionals from time to time, probably way more than time to time, right? Can you tell us a little bit more about what you see there and how some of the actions you're taking are helping to fix that?
I see it with Dr. Bellini quite often because I think it's important to be real. I can't be up here and you're down here. I have to talk to you as if we're equals and we're in this together, and I'm not going to leave you here alone. And that's the biggest thing I see in our clinic is that you are a person and we care about you and we're going to do this together and we're not going to leave you alone. We're not going to talk at you. We're going to talk with you and we're going to do this together. And that's the biggest thing that I've learned here is motivating people and to feel love and inspiration and motivation, and that you're just not left out here alone to figure it out on your own.
And what Blue Circle Health does very well is help the person who signs up identify what they need in that visit, in that community, right? So they might be talking to the social worker or the diabetes nurse or the nurse practitioner, and the nurse practitioner says, you know, I see your numbers, you're spiking at, you know, after lunch several days a week. Yeah, I really struggle with, well, would you like to see the dietitian? Right? And then works in, you come and see the dietitian one time. She'd be happy to help you. By the way, she also has type 1, right? Or by the way, I work with her and she helped me reduce my mealtime spikes, right? So it's like Blue Circle Health is actually in and of itself as an organization going, as they're doing their own work and seeing the person say, wait a minute, I could help you do this. Oh, wait, you're struggling with that? Oh, you know, so that then they're referring in between themselves. And like that to me is everything, right? Is that they're not just saying, Natalie wants me to see the dietitian and they just stop and do that and check a box. There's no box at Blue Circle. I think that's what there's no box. It is, how can we, if we never had to think about any cost, what would we give to a person with diabetes? And that's what we get, right? They get anything they need, right? And for a lot of our patients, they come back and say that. How are you doing? Great, right? You're doing great? Yeah, I'm doing great. And those words we don't hear, you know? So that is everything, is that they pick and choose, and then they help them kind of extend out to improve those outcomes.
I mean, there's so much value that comes from just knowing there's someone in my corner rooting for me and who cares about how I'm doing. So that's really amazing. So we've kind of touched on, again, Natalie, as you said, just the tip of the iceberg around some of the things that make it hard and some of the limitations that you both face as clinicians. What can we do about that?
The first thing we did different than probably the average clinic is we got posters from Blue Circle Health that are on the back of every single exam room door in our practice. There's a QR code that anyone can sign themselves up. But we also talk about the psychological, the financial, the ability to talk to someone. You know, Quiana can't talk to every single person with type 1 in our practice every week. So what we do is we offer services like Blue Circle Health to say, we can connect you to someone. You know, the first person I sent to Blue Circle Health spoke with a social worker more than once a week. More than once a week. Do you know what the copay is for that? To see a social worker under insurance? It's next to impossible, right? For a couple of weeks, and then they backed it down to once a week, and then they backed it down, but they had a really tragic issue, and they went back up for a couple of weeks, for 6 whole months, right? And those are the things that what I tell people when we do it. So let's just do the psychological side, right? So we have that person that was just struggling. I have another person that just got diagnosed with some pretty severe retinal issues, and she's blaming herself and and I'm like, you know, when we got this, we didn't even have A1Cs. We didn't even have meters. There was not a meter. And you think this is your fault? It's not your fault, right? This is genetics. But to work through the guilt and the worry and the high glucose on your birthday and all the things that go with that, we rely heavily on Blue Circle Health because of that. Because you guys meet people where they are and you help them get through to where they need to as best you can in the 6-month program that they have. It's interesting because today I saw a patient in a follow-up visit, and you know the way Blue Circle Health works now is you get 6 months and then you're discharged, because it's not a chronic care model, right? Like, I want to make sure people understand that this is, let us help you put you back on your feet the best we can depending on what's going on. And in my note, it said patient can re-engage with Blue Circle Health in January of 2026. And I said to her, oh, it's December. And she lit up and she's like, I know, and January is coming and I can't wait to talk to my Blue Circle Health educator. And I have one of the top educators in the next room over, right? Like, and I've got Quiana, and I've got 2 pharmacists, and I've got an NP and a PA and 17 endocrinologists. And who she wants to see is the person that has type 1, that looks like her, that makes her feel like as part of this team together, right? That is what I can't do, right? That is what I can't do because I don't have enough resources to do it. So I think that's a really good example of what. Now, do they all go back every time? No, of course not, right? A lot of my referrals have been for insurance challenges. So psychological and then insurance, right? Where I'm going to be 26, I'm going to get kicked off my parents' insurance. What do I do? How do I pick? I don't know, right? And I certainly, in my 30 minutes with a patient, I am not going to be able to address that. But I can say to them, you can go to Blue Circle Health for 4 visits. You don't need to stay the whole 6 months. You don't need to engage with the dietitian, the psychologist, the endocrinologist. You might just need a social worker to help you organize how to do this, right? And then we've had several people that have engaged, lots of people who have engaged with endocrinology. And that's really interesting because we have plenty of resources for insulin adjustment here, but they go in for one thing and they're like, well, do you mind if we look at your glucoses? No. Right? I'd love for you to help me, right? I am not one that I don't own this person or their numbers. We all do, right? We do this as a community. So, you know, I want everyone to help. I just want to improve the outcomes, right? So we have medication, they have dietitians that are like, well, I do it this way. What do you want to try that? Have you ever thought about, but with personal history, because so many people at Blue Circle Health have type 1.
Yeah, can you talk a little bit about breaking through this perception that Blue Circle Health, for example, it's not just another free clinic. How do you kind of fight through that common stereotype with some of the people that you're helping?
I think the beauty of this program, and I wanted to say this, you treat the whole person. It's a wraparound support program. I don't have to go here, there, meet with this person, fill out this paper. It's a one-stop shop. And it's like real life support. You not only you go beyond glucose numbers, you get to focus on insurance coverage, mental health, food insecurities, maybe even housing. There's a multitude of things that you can see Blue Circle for. And I just think you cut through a lot of the red tape. And I think that's the beauty of this program. And like Natalie said, as little as you meet people where they are and not where you think they should be. So I think that's the beauty of it.
Amazing. All right. Well, I need to sit with that one for a minute. Let's take a quick break here. One of my favorite things is sharing stories from people who've participated in the program. And I have one here from Sarah, who's been living with type 1 diabetes for 20 years.
My name is Sarah Nunn. I am 27, and I was 8 years old when I was diagnosed with type 1 diabetes. For nearly 20 years, I navigated the disease with the help of my doctors, family, and friends, but I didn't have a community that truly understood what my life was like. Like a lot of kids with diabetes, I didn't have any friends with diabetes or any chronic illnesses who could relate to the struggles I had day to day. Growing up, this made it difficult to connect with people on a deeper level. Diabetes became a nuisance that I worried would interfere with my relationships. When I heard about Blue Circle Health, I had been struggling with insurance coverages and getting my medications, but upon meeting my peer support guide, Xana, I knew I would be taken care of. She answered all of my questions with care and interest. She, along with most of the Blue Circle Health team, had diabetes and knew right away what I was going through. I immediately felt hopeful that the team could give me the confidence to continue my journey. She connected me with other team members who helped me navigate everything from insurance to nutrition. The prescription assistance program was a huge help with getting my supplies, but the most helpful thing overall was having a community of people I could go to for guidance and support with no judgment. Blue Circle Health is an amazing program that I couldn't be more grateful for, and I wish more people knew about it so it could help them like its programs helped me.
Sarah, thanks so much for sharing your story. And, actually, I'd like to give a shout out to one of the many great organizations doing great things for people with type 1 diabetes. This is not an ad. There's no sponsorship. In fact, they don't even know I'm doing this. But for this episode's community partner spotlight, I want to highlight Diatribe. Diatribe's a small nonprofit organization focused on helping people with diabetes through education and advocacy. Their website and newsletters bring you the latest news on diabetes in a very understandable and down-to-earth way. They're also doing a lot of great work around diabetes stigma and raising awareness of time and range. You can head to diatribe.org to learn more and subscribe to their newsletter. Natalie, Quiana, welcome back. Quiana, I want to focus in on some of the things you've learned so far. Type 1 diabetes it's hard enough, even when there aren't complicating factors like disparities and discrimination and health inequities. Can you tell us about some of the things you've learned so far about disparities and discrimination in T1D that have really stuck with you?
It's funny. Research tells us that people who look like myself may not have access to AID, to pumps, or any type of technology. And even in the community that University Hospital serves, we still see that inequity in that. And so we try to figure out why. And I think it's important to think about how I think I'm one of the few who look like me who is training to be a diabetes educator and willing to go in the community to do it. And I think it's important when we train and when we talk about pumps that we show a diverse group of people who may be living with type 1 diabetes. I think that's the biggest thing that I have noticed is that, and I'm just in an effort to be transparent, I would have not thought that someone who looked like myself may live with type 1 diabetes. You just so commonly, most people live with type 2 diabetes. And it wasn't until I got into this environment that I realized, oh no, there is people who look like me who live with type 1 diabetes. So I think those are one of the big things that I have learned, and which made me very more motivated to go in particular under-resourced, underserved communities and be that example, and to be able to see somebody who looks like you, who can build trust very quickly and kind of educate you and bring you along this journey with you.
Are there situations where you're running into people who are actually misdiagnosed with type 2 diabetes? I mean, I think that sounds like one of the hardest things where you are living with type 1 diabetes, but all the tools and all the education that you have are focused on type 2 diabetes, and it's different. It just doesn't work as well. What have you seen around some of those misdiagnoses?
We see it often, surprisingly enough, and I've learned so much about, antibodies here, and we talk about screening in type 1 diabetes. So it's quite often that people are misdiagnosed, and a lot of times I feel like just certain tests aren't ordered or certain things just aren't done, and there might be a lot of bias related to that. It's just that we assume that people must be a type 2 because we're looking and judging the person sitting in front of our face. And I don't mean that in a negative way. I just think that's what I've seen since I've been here in the clinic.
Absolutely. We
That's
see that a lot, right? We say, oh, you're black, you have to have type 2. Oh, you have overweight or obese, you must have type 2, right? You are whatever, right? Like you're 55, you must have type 2. You right? And so every week in our clinic, every single week, we have more than one person that we discover by antibody testing to discover that they actually have type 1, right? And they feel like they're failing because they're doing what they're told to do and it's not working, right? That's how we, but we have to erase that prejudice of both color, right? Of both weight, of both, right? 65% of the people we see with type 1 have a co-diagnosis of either overweight or obese, and we're managing them.
I want to come back to thinking about Blue Circle Health and what are some ways that we can do a better job of uh, reaching those underserved communities? What should we kind of always keep in mind as we look to make a difference for people with type 1 diabetes?
I don't know if you do or don't already, but like I said, it's important to go in other communities. When I think about in Ohio, we have 3 large systems, which is Metro Health, Cleveland Clinic, and University Hospitals. But I also think of the neon clinics and some of the smaller clinics that might be missing a large population of people. And I also think, communicating with churches and YMCAs and other places who could benefit from having this service provided to them. Because if you don't come to these large healthcare systems, you may never hear about Blue Circle Health. And if you're underserved and under-resourced and don't have insurance, you may never see me. And I could be often misdiagnosed. So I think it's important to go a little bit further in the community and broaden what you already do, because I think some people might not have access to what we have here at University Hospital.
Anything to add to that, Natalie? I want to come back to what Quiana just said in a minute, but I want to give you an opportunity to jump in here too.
I think that people don't believe that Blue Circle is actually free. They want the glitch. They want the catch. So you mean like it's free for the first time, but then what? Do they need my insurance card? Or how do I copay? They don't really believe that it's actually this good. I think that is the message, that it's free, and it's really free though. It's not semi-free. It's not Tuesdays free. It's free, right? So I think that's a real challenge because people don't believe it, right? So getting out into the community, but also understanding the services. The posters have really helped us. I encourage anyone who wants a poster to get and it's not branded. It doesn't say some insulin on it or some GLP-1. It's just a picture of a person that says, these are the things. Do you struggle with any of it? Sign up. And we don't need to sign them up. They can choose to sign up on their own, which is really nice.
You two are amazing cheerleaders for us, and we're very grateful. We're through clinicians like you, we're able to help even more people with type 1 diabetes. Well, as we start to wrap up here, if I were to ask each of you for I don't know, some big takeaways from our conversation today. We covered a lot, and it's a lot to digest. And Natalie, I'm going to come to you first.
I think as a clinician, we need to recognize that we are not the do all end all be all, right? What we need to do is recognize that our system that is in place right now, wherever you work, is not designed to support a patient in everything that they need with type 1 diabetes. It's not. So when Quiana calls a patient, we're paying for that nursing hour or nursing 30 minutes once a week or whatever. And it's a drain on our system, right? Because she's got to call, how many patients can she call in a day? 15, right? Like at 30-minute counseling. And that's her salary for the day. But, you know, we follow 100,000 people with diabetes, not all type 1, obviously, right? But we have that obligation under our belt, right? On our desk. So saying I don't have all the resources, but I have this amazing place where the resources happen under a grant from a trust that wants to improve your outcomes, that is going to help you explore what you need. I mean, that's, I think, a big part of it. Blue Circle Health helps you explore what you need because you might not even know because you're so overwhelmed with everything you're trying to do, right?
I love that. Yeah. What a great sentiment there. Kiana, how about you? If you were to give us a takeaway or two from our conversation, what would that be?
Blue Circle Health is a health equity model. And I think that it acknowledges that diabetes outcomes are influenced by social determinants of health. And I think we don't just we focus on not on individual choices, and I think that's the beauty. I mean, Blue Circle, in my opinion, is a system breaker, right? They break down these systems that often prevent people from having the best outcomes when they manage their type 1 diabetes.
Amazing. Thank you. So I have one last question that I ask every guest that comes on the show. And this time, Kiana, I'm going to start with you. After all the time you've spent dealing with diabetes and learning about diabetes, what is one thing that still surprises you about type 1 diabetes even today?
Maybe all the things and all the resources and all the technology and all the things that people don't know that they probably have access to. And they just need someone to kind of tell them about it and help them get it.
Natalie, what about you? What's one thing that still surprises you about type 1 diabetes even after all this time?
I think that people are not given the benefit of the doubt, or that we assume that they know. You've had diabetes for 28 years. You don't know how to carb count. You've had diabetes for 32 years or 14 years. You don't know blank, right? You haven't had a retinal scan, or you haven't done what? And they're trying to like keep their heat on, right? Or they're trying to pay their mortgage, or their marriage is falling apart, or this is happening, right? That there's so many assumptions made in the background. That's what surprises me, that when we see people here, it's like, okay, let's just start again. Let's pretend you don't know anything and let's just start from zero. The amount of judgment is shocking to me.
I will agree with that 100%. Well, thanks both of you for coming and sharing some time with us today. Thank you both for what you do in your everyday lives. The world is a much better place because of it. So thank you. If this episode resonated with you, why don't you think about sharing it with a friend who might be struggling to see eye to eye with their healthcare team, and just let them know that they're not alone. And then be sure to tune in for our next episode where we're taking a timely look at realistic goal setting as we approach the new year. I hope you'll join us. And until then, keep living well with T1D.